good. How are you?
I'm good. So today we're going to be talking about Malachi, and I'm going to be addressing questions about the screening process and describing the tools we used, as well as the subtests and the reasons for why he's been referred to us. So we're referring Malachi today for some medical and health concerns that we had in regards to his background information, as well as some behavioral reasons that we've seen. We're concerned about his developmental history in regards to the umbilical cord risk and him being premature at birth. In regards to his behavior, we want to address and look deeper into the temper tantrums that he's been demonstrating, as well as aggression and his tendency to hurt himself. So we went ahead and did a Bailey screening, and here is a summary of the results.
Thank you.
So the Bailey screening is a way to assess and score different developmental domains in children who could potentially be at risk, and Malachi falls under that category. So this test will help us assess any potential delays that he may have to then proceed forward and seek interventions if necessary. So the tool was administered within a norm sample, which is the score of an average child, and the Bailey screener has been proven to be a reliable and valid standardization assessment. And validity is the test's ability to measure what it claims to test, whereas reliability is when the test is repeated and the results are constant. So, in regards to the subtests included, for children 12 months and under, like Malachi, the time is 15 to 20 minutes for each subtest within one sitting. The administration methods will be adjusted based on each child's temperament. So, in regards to the cognitive domain, which you can see at the top, that assessed his attention, novelty preference, problem solving, and manipulation. And Malachi scored a 9, which is competent. And for receptive communication, we assessed his ability to respond to things like voices, words, and hear voices and words. And he scored a 4, which is at risk. As well as for expressive, he also scored at risk, and we assessed his ability to engage in pre-verbal and communication, and he scored a 1. For fine motor, we assessed his ability to use small muscles and manipulation, and he scored a 9, which is competent, which we were excited about. And then for gross motor, we assessed his ability to use his large muscle movements, and that was a 13, which is very competent as well. So in regards to his profile, we determined that his history is significant, and the Bailey goes ahead and shows that he's emerging in cognitive and at risk for communication, but definitely competent in fine and gross motor. So for Malachi, this information means that he has potential options for being referred to interventions in regards to his language and communication development, and we are more than willing to get him started in that process with services and help out as much as we can. And we want to complete a full Bailey to test his cognitive, receptive, and expressive communication. And for intervention, we want to refer him hopefully to a speech pathologist to work with him further around the time that he turns 1 and gets a little bit older, as well as a behavior specialist who can help with the tantrums and address the self-injury habits that we've been seeing. Do you have any further questions or need clarification?
No, I think that sounds good.
Cool, thank you. Thank you for your time, and have a great day.
Thank you.